Good afternoon, everyone. Welcome to our Aging at Altitude webinar series. Thank you so much for joining us for our lunchtime conversation today. My name is Lindsay Haynes. I will be moderating today's event. I am the event manager with Prairie Mountain Media. So our Zoom webinar format gives all of you the opportunity to submit questions for our speaker at any point during today's presentation. So whether you're on a mobile device, a tablet, or on your computer, you just look for the Zoom screen, the Zoom icon on the bottom of your Zoom screen, and there's a Q&A box, and there is where you can submit any questions that you have. We also will have an active chat box as well. Feel free to throw your questions in there at any point during the presentation. So today's topic will be covering dental health, getting rest for the rest of your life. Dr. Andrew Kelson from Dental Horizons will be talking about how your dental health tells a story about your sleep. So that being said, I will go ahead and turn it over to Dr. Kelson.
All right. Thank you, Lindsay. So I'm excited to share, this presentation, how your mouth tells a story about your sleep. I start by, let me just share my screen here. And okay, I know we practiced this. So here we go. There we go. So I start by sharing a picture of a fountain. It reminds me of a fountain of youth, and I don't know if there is a fountain of youth, but if there were, I would believe that it would involve getting good sleep. And so I think as we age, sleep becomes more and more precious, so that when we are awake, that we're able to enjoy life a little bit more. I wanted to share a brief video with you. And this is from Matthew Walker. He studied sleep at the University of California, Berkeley. And just want to watch a couple minutes of this that really shares the importance of sleep. You hear that?
My name is Matthew Walker. I am a professor of neuroscience and psychology at the University of California, Berkeley. I am the author of the book, Why We Sleep. We certainly know that a lack of sleep will actually prevent your brain from being able to initially make new memories. So it's almost as though without sleep, the memory inbox of the brain shuts down and you can't commit new experiences to memory. So those new incoming informational emails are just bounced and you end up feeling as though you're amnesic. You can't essentially make and create those new memories. We also know that a lack of sleep will lead to an increased development of a toxic protein in the brain that is called beta amyloid, and that is associated with Alzheimer's disease, because it is during deep sleep at night when a sewage system within the brain actually kicks into high gear and it starts to wash away this toxic protein, beta amyloid. So if you're not getting enough sleep each and every night, more of that Alzheimer's related protein will build up. The more protein that builds up, the greater your risk of going on to develop dementia in later life. What are the effects of sleep deprivation on the body? Well, there are many different effects. Firstly, we know that sleep deprivation affects the reproductive system. We know that men who are sleeping just 5 to 6 hours a night have a level of testosterone which is that of someone 10 years their senior. So a lack of sleep will age you by almost a decade in terms of that aspect of virility and wellness. We also know that a lack of sleep impacts your immune system. So after just one night of 4 to 5 hours of sleep, there is a 70% reduction in critical anti-cancer fighting immune cells called natural killer cells. And that's the reason that we know that short sleep duration predicts your risk for developing numerous forms of cancer. And that list currently includes cancer of the bowel, cancer of the prostate, as well as cancer of the breast. In fact, the link between a lack of sleep and cancer is now so strong that recently the World Health Organization decided to classify any form of nighttime shift work as a probable carcinogen. So in other words, jobs that may induce cancer because of a disruption of your sleep-wake rhythms. We also know that a lack of sleep impacts your cardiovascular system, because it is during deep sleep at night that you receive this most wonderful form of effectively blood pressure medication. Your heart rate drops, your blood pressure goes down. If you're not getting sufficient sleep, you're not getting that reboot of the cardiovascular system. So your blood pressure rises. You have, if you're getting 6 hours of sleep or less, a 200% increased risk of having a fatal heart attack or a stroke in your lifetime. There is a...
So I want to stop there. I think it points, makes the point that I want to make, and that is that, you know, good sleep really equals better health. We can't have good health if we're not having good sleep. And he pointed out several different examples of that. Specifically, I want to talk about, there's a lot of different types of sleep disorders. Sleep apnea is the one that I specifically want to talk about because it is mostly associated with a dental or oral condition. And really want to first dispel the myth that sleep apnea, you know, only occurs in people that are obese. Sleep apnea is there is an anatomical component to it. And I see this in patients that are very fit, very thin. But I think sleep apnea, obstructive sleep apnea, which is OSA, often kind of gets incorrectly tagged as a fat man's disease. And it really is not. What happens is when you're laying on your back, the soft tissues relax and they fall back into the airway, causing an obstruction. And then you're not able to breathe. Sometimes cutting off that airway and one will stop breathing for 10 seconds. That's the definition of an obstruction. So if someone stops breathing for 10 seconds, and sometimes that may happen anywhere from 5 to 30 times an hour. And so if you can imagine what that begins to do to all of your other systems, it can be problematic. But obstructive sleep apnea is the condition that I want to focus on today. And I asked the question, does it really matter how we breathe? You know, we need to get air to our lungs. So in this case, this gentleman is breathing a deep breath of air through his nose and getting air to his lungs. This gentleman is also getting air to his lungs. And this gentleman is also getting air to his lungs. But the way in which we're getting air to our lungs is very, very different in all three of those examples. The gentleman on the bottom with the mask, certainly the airflow is compromised. The gentleman up with in the hospital, and that's purified air as well, but he's breathing in a different way. The way we breathe affects all of our nervous system. So we have a sympathetic nervous system and a parasympathetic nervous system. The sympathetic is the fight or flight, and the parasympathetic is the rest and relax. So when I'm breathing really deeply through my nose, I'm relaxing all of those other systems. When I'm running and in a state of stress and breathing heavily and shallow, that's going to upregulate the sympathetic nervous system, and all those other organ systems are then affected by the way I breathe. I want to share with you another video that was done by a pediatric dentist, Dr. Jimenez, and it's about 3 minutes long, and it is jammed packed with a lot of information. So I want you to hang in there with me. About halfway through it, it starts talking about how the way we breathe affects our teeth. But after we watch it, we'll break it down.
The normal or physiological way of breathing is through your nose. Breathing through the nose permits to purify the air by the structures inside the nasal cavity. In that way, the air entering into your naso and oropharynx, your throat, is not going to heavily affect the lymphoid tissue in the adenoids and tonsils, which is the last barrier to catch harmful particles in the air before it reaches your lungs. Besides clearing the air from harmful particles, nasal breathing stimulates the production of gases and substances in the nose, which are going to facilitate the entrance of the air in the lungs and prevent infection in your respiratory system. Mouth breathing allows the air to pass directly into your throat, where the adenoids and tonsils are located. In that way, the air entering into your body through your mouth has not previously been purified, and the lymphoid tissue in the adenoids and tonsils become the first defensive barrier against the harmful particles contained in the air. As a consequence, that lymphoid tissue overgrows, occupying a large volume of your throat. That makes more difficult for the nasal breathing, and you make a habit of breathing through your mouth. In order to breathe through your mouth, your lower jaw has to come down, as well as your tongue has to rest on the floor of your mouth. Breathing through the nose is the correct way, and so the tongue is able to rest on your palate, stimulating a normal growth and development of your upper jaw. Conversely, when you breathe through your mouth, your tongue has to descend and protrude. At the same time, the pressure of your cheeks increases, pushing the upper jaw inwards. So the growth and development of your upper jaw is negatively affected, resulting in a narrow and high palate. The upper dental arch acquires a V shape instead of being a rounded dental arch. Therefore, your teeth do not have space to properly align. This also produces an incorrect swallowing function. Every time you swallow, between 1,600 to 2,400 times per day, the tongue positions low, staying away from your palate. That forces the tip of your tongue to position between your upper and lower front teeth. That pushes your front teeth to show out of your mouth, and your tongue resting on the floor of your mouth with the tip of the tongue between your front teeth. That is called an open bite, as your upper and lower front teeth do not touch when you close your mouth. All those dysfunctions, mouth breathing, incorrect tongue posture, open mouth, and incorrect swallowing are going to continue affecting the growth and development of your upper and lower jaws. And as a consequence, there is less room for your teeth and they become crooked. Remember, the nose is for breathing and the mouth is for eating. Breathing through your nose and keeping your mouth closed with your lips together is going to help your upper and lower jaws to grow and develop better. But more importantly, it makes you healthier.
Right, so a lot of information there. I want to just highlight some things. First, nasal breathing purifies the air, and it's the primary or the first way to purify the air. It then hits the tonsils and adenoids that then become the secondary filters. And if that's not happening, then if we're breathing through our mouth, the tonsils and adenoids become the primary filter and just become bigger and bigger and bigger. So I see that in patients quite a bit as we're looking in the back of their throat where the tonsils are just huge. And that tells me that they're breathing through their mouth and they're not getting that nasal breathing. Nitric oxide, I mentioned it produces these gases. So the nose produces nitric oxide, and it's a powerful antiviral, antifungal, antibacterial. And that's what we need right now. Our body is designed to filter all that bad stuff out of the air, but it has to go through our nose. The other thing that nitric oxide does is it's a vasodilator. What that means is it makes our blood vessels bigger, and that reduces our blood pressure. And so if we're breathing through our nose, we're going to be healthier. Our cardiovascular system is going to be not as stressed. And then the other components of this video that are really important is that our tongue posture really helps develop the upper jaw. And our swallowing habits develop the upper jaw. Our tongue acts as like a scaffold. And so it's pushing the roof of our mouth, it's putting pressure on the roof of our mouth to expand everything both sideways and forward. And so every time we're swallowing or as we're breathing, it's putting those very light pressures and helping the upper jaw grow and develop correctly. And then what that does is it helps us breathe better as we become adults. So nasal breathing then helps us sleep better, which then helps us have better health. And so that's the connection, this path that I want to take us on. I want to talk a little bit more about our tongue. When we are in embryo, we have connective tissue that's initially formed between different structures. And then as we grow and develop, this connective tissue is removed. It's called apoptosis or cell death. And so in the case of our fingers, we have this connective tissue. In this case, it just wasn't removed completely and didn't fully form the fingers. Well, that same type of connective tissue forms underneath our tongue. And that piece of connective tissue runs from our tongue all the way down to our toes. Well, as we're growing and developing, that apoptosis occurs, that cell death, it then begins to release that tissue. But it doesn't always fully release. And so many of us have what's called a tongue tie, where it wasn't fully released. And there have been a lot of new research that's developed that is showing that many other conditions are connected to this tongue tie. Now there's different variables or different degrees of tongue tie, but you can imagine this patient with the fingers that are fused together, they can function just fine. They can do everything that they would normally do. And other than an aesthetic issue, we probably wouldn't do anything with it. With the tongue, similar situation. Many patients have a tongue tie, but they've been able to function and manage and don't even know that it's there. And it hasn't been addressed because really no one knows about it. Final video I want to share with you, again, kind of pulls everything together. And I'm going to need to share this differently. All right, hopefully you can see that and hear that.
Proper breathing is critical to a person's health. Having an upper airway that lets oxygen flow freely into and out of the lungs is necessary for overall well-being. But if the upper breathing passages are narrow or blocked, it makes breathing more difficult. During sleep, a lack of the necessary oxygen puts a strain on the heart and brain and may cause complications. Your dental provider plays a crucial role in identifying airway problems. They are often the first health professional to identify airway dysfunction because of the signs that can be observed within the mouth. A person's airway may be restricted due to certain anatomic features, such as a small mouth or throat, overly large tonsils or adenoids, or an elongated uvula and soft palate. A blockage of the upper airway during sleep is often due to the relaxation of the tongue and soft palate moving to the back of the oral cavity. The potential signs of a restricted airway include tooth grinding, tooth wear, tooth decay, having crowded teeth, nasal issues, obesity, mouth breathing, and snoring. Often, treating a dental issue like grinding or tooth wear will simultaneously improve a patient's airway and sleep quality, and lead to an improved quality of life. If left untreated, the constant strain placed on the heart and brain, coupled with poor sleep quality, can result in insomnia, chronic fatigue syndrome, fibromyalgia, gastrointestinal issues, depression, anxiety, nighttime teeth grinding, and cardiovascular difficulties like high blood pressure and stroke. Given the potentially serious complications, it is critical to work closely with your doctor to screen for airway issues and develop a treatment plan that meets your unique needs.
All right, we're going to go back to that screen. All right. Can you see that now? A tongue posture.
Not yet.
Okay. Let me... There we go.
Perfect.
Okay. So our airway and how we're sleeping and getting good air is going to affect our teeth. If we're struggling to breathe at night, we're going to be clenching and grinding our teeth, which then leads to tooth fracture. If we're breathing through our mouth at night, we're going to have a ripe environment for gingivitis or bleeding. You might brush and floss and do everything that you can do, and then you come into the dental office and your tissues are bleeding, and you're like, what's going on? Well, potentially you're breathing through your mouth. Tooth decay is mouth breathing is a ripe environment for promoting tooth decay. So these are all dental issues that manifest themselves in the oral cavity when someone is struggling to breathe at night. And tongue posture is really one of the keys to that. The previous video showed that where our tongue is resting, if it's resting on the roof of our mouth or on the base of the floor of the mouth, is going to determine whether or not we're breathing through our nose or our mouth, which leads to better sleep, which leads to better health. So it's all very much connected. Again, the anatomy of our airway and how air flows in the airway then is determined by that tongue posture, determines nasal breathing, which determines better sleep and better health. So I want to share some more examples of how the teeth tell a story about the growth and the development of someone's airway, and then how they're sleeping at night. This patient here, you can appreciate that there's some crowding. This is their upper arch. And the reason there is crowding is not because the teeth are too big, but the upper jaw is too small. The upper jaw never fully developed, and then therefore, now there's crowding. And the upper jaw never fully developed because the tongue wasn't there pushing it out of the way. Another example. Here you can see the tongue. This is the lower arch. And the tongue is resting on top of the bottom teeth. It's resting on the floor of the mouth. And there's really no room for the tongue. It looks like this patient might, if they were to bite down, they would be biting on the tongue, because the tongue is trying to get out of the way, is trying to push itself forward, get out of the way of the airway so that that patient can breathe. Another example of the lower arch, you can see this, these are called bony tori. They're growth, extra bone growth. And so someone who is clenching and grinding their teeth is really biting down really, really hard and using the muscles of mastication at night in a way that's, they're putting more force on their teeth than they would if they were ever biting into a steak. Well, that constant clenching of that muscle begins to build the bone. And then there's this overgrowth of bone. So when I see that, it's a clue that the patient is clenching at night. The other thing I'm seeing is this connective tissue that I mentioned before, this tongue tie. The tongue, in this case, has good posture. And then another case here, similar situation. I want to point out this, sorry, my screens. This scalloping right here. So this indentation, what's happening is the patient is pushing their tongue forward, and those marks coincide with the marks of the teeth. So that patient at night is trying to get their tongue out of the way, pushing their jaw, pushing their tongue forward, and it's creating these marks on the tongue. Another thing I want to point out is on both of these cases, they are missing premolars. So in this patient here, there's 2 molars and 2 premolars, where in both of these cases, their premolar was removed. So in the 1970s and 1980s, that was a fairly common practice. When the upper jaws and lower jaws were underdeveloped, there wasn't room for the teeth. And so the dentist or orthodontist would go in and remove one of a set of teeth, and in order to make them straight. And in this case, you know, they're relatively straight. But what that tells me is that the jaws just never fully developed, and now it's manifesting in sleep apnea. One other case, you notice that the wear on the teeth. These teeth are really, really short. Well, it's because this patient at night is clenching and grinding their teeth, trying to move the lower jaw forward to open up the airway so that they can breathe better. Well, that constant grinding then begins to wear on the teeth and make them short. And then finally, this patient, again, has some crowding. You'll notice the very deep palate. So right in here, that's very deep and very narrow. The roof of the mouth is also the base of the tongue. And so if the roof of the mouth is very narrow, the base of the nose, not the base of the tongue. If the roof of the mouth is narrow, then the base of the nose is narrow. And so then the flow through the nose is not as prominent as it would be if those nasal passages were wide open and broad. So when a patient comes in and we're doing a dental examination, these are all clues that make me ask questions. Well, how are you sleeping? Are you snoring? Snoring is an indicator that there is a poor passageway in the airway. And if we're able to determine that there's potentially a sleep condition, then we're able to do something about it. Typically, that means getting a sleep test. I'm not able to diagnose sleep apnea, but I'm able to see signs within the mouth that clue me in to say this patient is potentially suffering from a sleep disordered breathing condition. Then we're able to get the sleep test, get a sleep diagnosis, and then treat appropriately. So again, this path to better health, our airway is helping to determine the growth and the development of the jaw. When there's underdevelopment of the jaws, then there is crowding in the teeth and the dental arch anatomy is constricted. Then when that dental arch anatomy is constricted, it then is this cycle, negative cycle, where it's constricting the airway. And all of those then lead to poor tongue posture, poor nasal breathing or mouth breathing, which then reduces our sleep and decreases our health, or the vice versa is true. When we've got good tongue posture, we can have good nasal breathing, better sleep, better health. So this is what we're doing in our office. We're through technology, we're able to do a 3D scan of your airway. We're able to look at your airway right here and measure volume. We're able to look at the soft tissue. We're able to look at the tongue. Here's another example of, we just pulled out the airway, and you can see right here there's a constriction. This is where the patient's volume is pretty narrow, and what that equates to is poor sleep. If we could just move so this is your upper teeth, your lower teeth, your tongue is right here. If we could encourage the movement of the tongue this way by encouraging growth and development, or encouraging the the upper jaw to move forward and the lower jaw to move forward, then we will be able to open up this airway and the patient will be able to sleep better. We not only look at the mouth, but we look outside the mouth. So we take photos, and these photos give us clues to what might be happening. We're looking at their eyes. A patient that is suffering from sleep deprivation or poor sleep is going to have dark circles under their eyes. We're looking at neck posture. Someone that is moving their head forward is essentially trying to open up their airway, not only at night, but during the day. We're looking at asymmetry. We're looking at shoulders and their posture. All of these things give us clues as to how a patient may be breathing. Of course, we take photographs of the inside of their mouth as well, looking at the palate, looking at the teeth, looking at the tongue. We take a 3D model of the teeth, and we're able to analyze that when a patient's out, not in the office. And then these are the different types of therapies, oral appliance therapies. When a diagnosis is made, we get a sleep physician involved to make a diagnosis, but there's a couple different options. One is a simple night guard. And a night guard will protect the teeth. It will prevent the teeth from wearing down and getting short and cracking and those types of things. But it doesn't address the underlying issue, which is the airway. There are other oral appliances. This one right here essentially moves the lower jaw forward, and the patient would sleep with that. And as they're sleeping with that, then it opens up the airway, it gets the tongue, it creates space for the tongue. And this is traditionally what dentists have used to treat sleep apnea. But there's another appliance that is relatively new and is exciting because it's not only addressing the lower jaw, but it's addressing the upper jaw. It's expanding the palate and expanding the upper airway, remodeling the upper airway to allow more space for the tongue. And in this case, the patient would be wearing it at night as well as during the day until that remodeling has occurred. And then after that, they don't have to wear it anymore. So that's really exciting. It's a non-surgical treatment. That would be another way to treat this condition, is surgically move the upper and lower jaws forward. But these dental appliances now can non-surgically influence and remodel the airway so that it creates more volume. And then finally on the right here, these are appliances that children can wear as they are growing and developing to prevent this in the first place. And so that's really exciting for us, is that we're able to really play a preventative role and help patients learn to nasal breathe, get the tongue in the right position, help the skeletal bones grow the way that they need to. Another kind of side note is that the maxilla, the upper jaw, is connected to 9 other bones in the skeleton. And so if we can influence the maxilla to grow and expand correctly, then that's going to influence a whole lot of other cranial bones, which just assist in the growth and the development and the breathing. And then finally, I just wanted to share, a patient came in last week. I thought this was kind of perfect timing. So he had been going to bed at 10 o'clock and then falling asleep very quickly just because he's exhausted. He would wake up at 1 or 2 a.m. in the morning every night. And he was diagnosed several years ago with sleep apnea. He was treated with a Cpap, which is essentially a mask, and it blows air through your nose or through your mouth and gets air to your lungs while you're sleeping because of that obstruction that has occurred. And he said, I would go through the day pretty sluggishly and just make it through the day. And he was doing this for years. We moved him to a dental appliance. And in 3 weeks, he came back last week, and this is what he said. He said, I can't tell you how energized I feel every day. I'm much more active, much happier. My mood is increased. Even my wife has noticed I'm a happier person to be around. I have dreams now. I haven't had dreams in many, many years. And so this is just really exciting for us, is because, most patients, when they go to the dental office, we get a lot of, oh, I don't want to go. And when we're talking about sleep and helping patients sleep better, it's just really exciting for both the patients and us to help treat that. And so absolutely, the teeth tell a story about what's going on in your sleep. And the mouth is the entryway to, the mouth and the nose is the entryway to our respiratory system. And our respiratory system plays a role in all of the other systems that are in our body. And we pay a lot of attention about what we eat, our digestive system. We pay attention about our blood pressure, our cardiovascular system. We pay attention about exercise, but we don't really pay attention about how we breathe, because it's just so natural. But it turns out how we breathe is really, really important. And so we're excited to be a part of that, and would love to be able to share with you more, and work with you. We are Dental Horizons. We're on the corner of Nelson and Airport Roads. And just thank you for your attention and your time. And Lindsay, I'll turn it back over to you.
Excellent. Thank you so much for that awesome presentation. I mean, I know for a fact that for me personally, I do visit my dentist on a regular basis, but I never even considered, what it could impact for my sleep. So thank you so much for your presentation today. So we did have some questions that came in during your presentation, so I'll go ahead and jump into some of those. But for everybody, if you have any questions, we will jump into our question and answer portion. So again, that question box is just at the bottom of your Zoom screen, or you can send us a chat. Okay, so can maladaptive breathing contribute to developing a hiatal hernia?
I don't know. I do know that breathing affects a lot of systems that, and every system in our body. So I don't know of any research that shows that. I'm sure there is something. Intuitively, I believe there is some form of connection. Many of the health conditions we have an oral component to them. That doesn't mean if we fix the oral component, then all other conditions go away. But it certainly does mean that there can be an oral component.
Awesome. Okay, let me just scroll over to here. So sleeping with oxygen often dries my mouth. How do you feel about xylitol moisturizing spray at night?
Yeah, so there are lots of different ways to combat dry mouth. Xylitol is a great product, and it's one of the better ones.
Good. Okay, next question. We have both dental and medical insurance. Which one would we use to have an evaluation in your offices?
So this falls under medical. Oftentimes, if there is a diagnosis of apnea, then there can be medical coverage. It doesn't always mean there will be, but we can work with you to determine if there is that medical coverage, and certainly we'll tap into that if there is. On the kiddo side, this would fall more under dental orthodontic coverage.
Okay.
But for adults, again, if there's a diagnosis of apnea, then oftentimes we can get the medical involved.
Okay, great. So can you use an oral appliance at the same time as a CPAP machine?
Yes. So oral appliances are really, really good for treating mild to moderate sleep apnea. Anyone with severe sleep apnea, typically the CPAP is still going to be needed, and we would want to work in conjunction with your physician for that. But depending on the design of the oral appliance and also the type of CPAP, they can be used together.
Okay, great. So does insurance, this is another insurance question, cover the cost of oral appliances? And then what do those costs typically look like?
So again, every insurance is a little bit different. So I hesitate to really get involved with the insurance question. I will say this, our team is very good about tapping into those. And what we can do is, figure out what your insurance is and answer those specific questions a little bit more appropriately.
Right. Okay, great.
Typically, let me address the cost issue. Again, it's going to depend on the type of appliance we're using. A night guard is going to be a couple $100s. The appliance that you're wearing day and day night, it's going to be a couple thousand.
Mm-hmm.
The good news is that after wearing that appliance, the goal is to get rid of that appliance, to actually treat the condition. And that's what's exciting for us, is that all of these other treatment modalities, they are essentially managing the condition.
Mm-hmm.
And if we can help remodel the structures, then we're actually treating it, which is exciting.
Right. So can neck arthritis affect your teeth, specifically your lower teeth?
Yeah, so it's all connected. So, and that's one of the things that I mentioned, kind of what we're doing in our office is we're taking a scan, we're taking photographs, we're doing a very thorough medical history, we're doing a very thorough head and neck exam. We're asking a lot of these questions because every patient's a little bit different. And if you're not breathing, all of these other chronic conditions, chronic inflammatory conditions, chronic cardiovascular conditions, chronic muscle conditions, connective tissue conditions, it's all connected. And so, again, I'm not going to say that if we do this, then all of a sudden all those other things are going to go away. But I will say there is an oral component to all of those things. And when we treat that oral component, many of the symptoms of those conditions are reduced and sometimes removed.
Mm-hmm. One thing that I thought was amazing was the amount that your tongue can have effect on the alignment of your teeth. So I know everybody's different and every case is pretty unique, but if you are a continuous mouth breather and your tongue is doing that to you over time, how long does it normally take for teeth to kind of start to make those shifts?
Yeah, so this is, there's a lot of investment that is made through orthodontics to get the teeth nice and beautiful.
Right.
and then you say, wear your retainer. And it just doesn't happen, right? Life happens and the retainer you move and it gets put in a box and the retainer's lost. And so there's a muscle that is constantly pulling all of those teeth back into position where they were in the first place because of the growth and the development that occurred to begin with. Mm-hmm. And so moving the teeth, it makes everything look good, but unless you address the underlying issue, which is a very strong muscle pulling things back where they want it to be, unless you address that, then there is going to be relapse of the teeth. And that can depend, the pace at which that happens, again, is very individual, depends on how attached that muscle is. Some patients, it's a very minimal attachment. And in others, they can't even stick their tongue out because that attachment is so strong.
Uh-huh.
But doing orthodontics and not addressing the tongue and evaluating that is a really good way of doing orthodontics again when you're 20 or 30 years old.
Mm-hmm. It's amazing. So, is there an over-the-counter brand of night guard you'd recommend to start experimenting with before reaching out?
Yeah, over-the-counter. So the purpose of a traditional night guard, the one that I showed you, it's a hard acrylic, and it opens up the jaws. It creates some space between the jaws, and it allows the jaws to slide around, and it doesn't, lock the teeth together. And so there's some benefit to that, because what that does is it allows the lower jaw to move around and get out of the way. And because it's a hard acrylic, your body is going to, because we're opening things up, it's actually going to open up the airway. Many of the over-the-counter night guards is it's soft acrylic, or soft rubber actually, right. And it's going to be more like a toy, and you're going to be wanting to clench it and play with it while you're sleeping. It actually is counterproductive because it's this toy. Now there are some patients are concerned. I don't know if I would be able to tolerate a night guard, and so I hear that I want to go buy something over the counter and just see if I can tolerate the night guard. Mm-hmm. One of the indicators of someone not being able to tolerate a night guard is that they have sleep apnea. So when a patient comes in and they're not able to tolerate that, that is a clue to me that there's something else going on. And so I really would discourage that over-the-counter night guard. It actually does things that are worse. You're almost worse off by wearing that.
And I know that with the over-the-counter ones, sometimes, you mold them to your mouth by microwaving them or putting them in that hot water, and it might not even mold to your mouth correctly. I've made that mistake personally myself.
Right. It actually locks you in place, and that's exactly what we don't want.
Okay. Yeah, that makes great sense. So with those appliances that, you mentioned a couple, and so how long normally does it take to treat sleep apnea in your offices? And I know, of course, it's case by case definitely, but if there's just a general.
Yeah. Usually I'm telling patients anywhere from 18 to 24 months. And that's with day and night use. And so you're wearing it at night, and then you're wearing the upper appliance during the day. We're recommending anywhere from 14 to 16 hours a day. So that means, you get home from work, you pop it in, take it out to eat dinner, you pop it in again, you're wearing it the entire evening, you're wearing it while you're sleeping, maybe a half hour in the morning, take it out when you go to work. And so the longer you wear it, the shorter the treatment time is going to be. And that's the thing about this treatment. It only works if you wear it. Mm-hmm. Now, there are other appliances that you wear just at night, and that manages the condition, but it doesn't really treat it.
Yeah, okay.
What we're trying to do is we're trying to non-surgically help the body heal itself. Mm-hmm. And we're just creating a mechanism for the body to know where to grow and where to expand. And that's just a natural way of healing itself.
Mm-hmm. So you did mention, that you wanted to be in good contact with somebody's, primary physician or health physician. So when people are considering going in for a sleep study, is that something they would do as a first step, or do you recommend that depending on maybe their symptoms, they come see somebody like you first? What do you think on that kind of topic?
Yeah, if they've already been in contact with their physician and they already know they have sleep apnea, then getting that sleep test through your physician, you're kind of already in the queue there. So that can be a good avenue. If you're not sure, if you're just, man, I feel tired all the time. I do know my teeth are crooked. I know that I know I'm clenching my teeth at night. Then just come see us first, and we can determine what are the other signs that are happening, that we can then make an argument for a sleep study.
Okay.
The sleep studies they're pretty easy now. You can take them home. You don't have to go into a lab, and the technology is pretty amazing. Another thing that you could do is there are pretty good sleep, like snore apps that you can download on your phone.
Oh yeah.
Snore Lab is one, and you can just kind of get a baseline. Hey, am I snoring? This, it's interesting to me. Patients will come in and I'll see all of these different signs. And I'll say, how are you sleeping? Do you snore? And like, oh no, I don't snore. No, I don't snore. And then I'll ask, well, do you purr? Because you don't snore, but do you purr? Do you,
Oh,
and,
right.
and so there are a lot of different degrees of sleep apnea. And a lot of times we don't catch it until it's really severe, until someone is caught like suffocating at night. Then it's a huge problem. But if we can catch this when it's just minor and just help the oral cavity remodel itself, then we don't have to get into these severe cases where it's not only affecting sleep, but it's affecting all these other organ systems.
Right.
Well, unfortunately, we are, we kind of wait until we're sick to do something.
Yeah.
And in the case of sleeping and in the case of breathing, there's things that we can do to help us breathe better that, are simple. Some other things that you could do that don't that don't require a large investment, but nasal strips.
Yes.
So sleeping with nasal strips before you go to bed, really cleaning everything out, blowing your nose 3 or 4 times, taking a hot shower to clean everything out. There are nose cones. Those are different types of nasal things that you can wear at night to help you breathe. And I find just doing those things are, if you do that and then you're like, wow, I woke up and I just feel so much better. That's a clue of what you could potentially be done on a permanent basis so that you're not having to wear nasal strips the rest of your life.
Right. So with, dental health and aging, what age is, quote unquote, too old for help from an oral appliance or any of those types of treatments?
The sooner the better. I mentioned kids, like if we can start helping kids right away with the growth and the development, that's certainly the best. But yeah, you in this audience, we're talking about an older population, and it's never too late. If you have teeth, and that's the key, this appliance, you need teeth, then it's something that can help.
And so I guess this one kind of goes into the next question that came in. So are appliances really effective for the geriatric population? So will the teeth move more effectively, even with sleep apnea or without?
So as I mentioned, there's different types of appliances. The mandibular advancement appliance absolutely is going to help at night and with breathing. The appliance that you're wearing during the day, there is still going to be some development. Is that development going to be a little bit slower? Are different medications going to affect things? Are different conditions going to affect? Yes. And so every patient is a little bit different. But if someone were 80 and they came to me, we would evaluate that and we'd see, well, what are we trying to accomplish? And I absolutely feel no matter what age you are, there's something that we can do to help.
So does your offices see smaller children, or are you referring out if somebody needs, if like somebody has a child who's snoring or, anything like that?
Yeah, we do see children as well.
Okay, great. Good. So while
let me just say something really quickly about that. We go into a child's room and they're snoring and we say, oh, that's so cute. And the reality is they are suffocating. Mm-hmm. And if there's anything that I can do to help kids grow and develop that upper jaw so that all of these other conditions go away, ADHD, often misdiagnosed as they're just sleep deprived.
Wow.
And they're going to school being put on medications for ADHD, and they just don't sleep because their tongue is in the way, their skeleton is not being developed. Mm-hmm. And so if we can help with that, that's empowering to me. Mm-hmm. I just want to shout that from the rooftops.
Right, absolutely. So typically, and I know, of course, this one's another case by case, but as you age, typical visits are twice a year. Do you recommend they maybe make more appointments per year, or do you recommend that based on their 2 visits per year type situation?
Yeah, so we're talking about, there's actually, can I share another slide?
Yeah, absolutely.
So let me, is that showing? Okay, is that showing up? Phase 1, phase 2? Okay, so typically when you go to the dental office, I created this because I wanted to share kind of our process. So phase 1 is like emergency treatments. When a patient comes in, if they've got a broken tooth or there's pain or trauma, we want to address that right away. Phase 2 is more disease control, inflammation and infection. So if there's dental decay, if there's periodontal disease, if there's an oral disease, some oral cancer, things like that, we want to address that. And quite honestly, most patients stop right there. And they say, okay, I'm just going to come in every 6 months and we'll address any sort of dental disease. And if that's the case, that's great. But there's more to dentistry, and we can offer more than what typically occurs in that 6-month visit. Phase 3 is more corrective or preventative. So this is where if they've got a missing tooth and it's affecting their function, we are replacing that tooth. This would be preventative. So, or any sort of cosmetic stuff, or coming in on a regular basis. So if a patient has periodontal disease, we may recommend that they're coming in every 3 months rather than every 6 months. Mm-hmm. And certainly we want to make sure that we're addressing that periodontal condition before we start remodeling the airway. We want to make sure that oral cavity is disease-free and being managed appropriately before we move on to the next phase. And then phase 4 is more complete dental health, where we're looking at the airway, we're looking at breathing, sleep, TMJ. The way you breathe affects your TMJ. If you're having a lot of pain up here, your bite, all of those things are affected by how you breathe. I don't know if that answered the question, but I guess the question was, yes, we may need to have you come in more than every 6 months.
But regardless, there's never a time where you should stop seeing your dentist, right? You should always at least have your twice a year.
Absolutely. Because we're addressing the teeth. And most of my career, that's all I focused on was the teeth. Mm-hmm. But the more and more I'm learning, there's actually a tongue, there's a muscle, and there's a skeleton too that we're looking at.
Awesome. Well, wonderful. Thank you so much for your presentation today. Like I said before, but I just really want to reiterate, there's just so many more aspects to your dental health that affects more than just, what's in your mouth, your sleep and your breathing and all of that kind of, stuff as well. So thank you so much for bringing this to us today. So we
Appreciate
actually have hit our 1 o'clock time. And so if there were any questions that didn't get answered or anything like that, we will be sharing the contact information here. We also have been recording today's webinar. So if you know of anybody that you want to see this webinar, or if you wanted to go back to it, share it with someone, that will be on our website by tomorrow. And so that website is dailycamera.com/aging. So the same location where you registered for today's webinar is where you'll be able to find the recording. So one more time, just thank you so much. And we will be back tomorrow, same time, same channel. Thank you, Dr. Kelson.
Thanks, Lindsay.